Second heart sound. Second heart sound is known as S2, which occurs due to closure of aortic and pulmonary valve. It produces dup sound, which is best appreciated in aortic and pulmonary area. Splitting of S2, normally aortic valve closes first then pulmonic. Gap between closure of aortic and pulmonary valve is 30 milliseconds. Effective respiration on S2, usually pulmonary valve is affected by respiration. During inspiration, pulmonary valve closure is delayed, and during expiration it closes early. Abnormalities of S2. First is narrow split S2, which means gap between AV and PV is less than 30 milliseconds. Causes aortic stenosis, hypertrophic cardiomyopathy, patent ductus arteriosus, left bundle branch block, Wolff-Parkinson-Wolff type B. Wide split S2, gap between AV and PV is more than 30 milliseconds. Fixed wide S2 is a feature of atrial septal defect, and variable wide S2 is seen in ventricular septal defect, mitral regurgitation, right bundle branch block, Wolff-Parkinson-Wolff type A.